Thanks. Okay, so another area that is obviously really important to address is the area of leadership and vision. You know, leadership really has to be pretty courageous and committed, I think, to facilitate these kinds of transformations, to ensure that all of these concepts are really firmly embedded in vision, policy, job description, in recruitment processes, in education, staff support and wellbeing. One quite nice example is in Arizona, Recovery Innovations Arizona, which do a lot of really quite amazing things in terms of recovery-oriented services. One of the things they do is their policies are communicated to staff in the form of letters. Nice, isn't it? So it's a personal communication of the vision of the organisation to staff to support them in their day-to-day practice of making the big picture transform into day-to-day work with people. And so it's very personal, very much around what is the relationship we have with staff. So I thought, well, that's a really nice example. Arizona also, just to mention, the leadership there were very, very keen to get peer support up and running. And, you know, they started off fairly small, and now 75% of their mental health workforce are peer workers, which is just brilliant and means that there are so many alternative ways of approaching situations. So, for example, if I end up on a community order for some reason and I'm using this service, I get invited to a series of seminars run by other people who themselves have been on those orders and come off them, called Getting Your Power Back. Yeah, so that kind of vision is, you know, can be communicated in some really important and real ways. In Connecticut, they worked very hard with service users, families, community members, workers, spent a lot of time talking about what their vision was. But the other thing was they also talked a lot about how will we know when we're doing it? What will we see? And they defined that. If I'm a service user, what will I see that I know that vision's being communicated? If I'm a family member, what will I see? And if I'm a manager or a worker or so on. So, you know, there are some really fantastic ways in which that transformative process can be communicated to people who are all part of that service system. Actually, it just makes me think of another thing, a bit of a Sandyism. Sandy talks of, you know, consumers are often talked about, or service users, as stakeholders. She says, we're not stakeholders, we're the critical reference group. That's great, isn't it? Yeah. And another, just to let you know, some of you may have found this book, Principled Leadership, written by Kevin Ann Huxhorn, who's very well known for her work around trauma-informed care, and William Anthony, who's also very well known for the work he's been doing around service transformation towards recovery. And what they did was they looked at leaders who they identified as being really kind of making a difference and moving services through this transformation process really well. And they studied that group and interviewed them and came up with, through their research, a book really identifying what was it about that leadership process that supported system change. So that's a really great one that we'd recommend if you're interested in thinking about leadership through this type of transformation. Now, the other area, and, you know, partnership. Isn't that a term that we've just heard over and over and over again? And I think when we're talking about partnership, the first thing we need to talk about is power and power imbalance. That's really the conversation we need to be having, because that's what gets in the way every single time. So, and it really needs to occur at all levels. And I think often we underestimate the ways in which people want to be involved. So, for example, at Salem Hospital, when they were trying to move towards more trauma-informed approaches, one of the things they did was every person who came onto the unit, they said to them, so whether they were a worker, a person who was there as a patient, a person who was there to clean or to serve a meal, they were invited, help us to do this. This is what we want. We want a safer, service that feels good for everyone, but we need your help. Tell us how we can do this. And one of the things they did was that they put their rates of seclusion on the wall, made it quite clear that they were working towards a reduction in those processes, and so everyone on that unit could see when the numbers came down. And it was really, really effective. I mean, even closer to home in Victoria, they've had some grants. I understand that the process was around sexual safety and mental health units, where people could get together in partnership, service users and workers together, to identify how they would be able to spend $20,000 to make a service, particularly an inpatient unit, safer. And so providing those kinds of opportunities for people to work together towards that end, I think, is really, really important. And the other thing, and I just can't say it enough, and I get eye-rolled a lot at work when I'm constantly talking, not at the Institute, but in my public mental health system work, peer support. I mean, I just can't say it enough. It's really, really crucial to making a better system, a better ways of working, more creativity, and more opportunities for healing relationships, which is what has come up pretty much in every presentation in this conference, I think. So just to finish up, I guess the cynics might say, well, we've been here before, you know, recognising the link between trauma and mental distress, and, well, what's different this time? I mean, one of the things that we would say, and sorry, I think that image might look a little clinical and hospitally. It's not meant to conjure up that image, but there you go. That was the late night deadline of getting PowerPoint slides in. But anyway, that, you know, maybe recovery opens a new door for us to be kind of really moving forward in this sort of transformation. And we'd say that really trauma-informed care and recovery-oriented practice are inextricably linked. And that service transformation towards one of those will invariably lead towards service transformation towards the other. And certainly the National Association of State Mental Health Program Directors in the US sees trauma-informed care as being a very important first step to becoming recovery-oriented. And I think that actually it certainly does, in terms of providing, I guess, maybe a bit of a framework for services to start making those changes. A trauma-informed care approach is really, really helpful. And the other thing is, it's not just good for people who've experienced trauma, for whom trauma is part of their story. It's also really good for people who haven't experienced trauma. It's also really good for workers, so it's definitely worth working for. Thank you.
I had a final thought on the train this morning. I texted to Kath at 7, reading back over Judith Herman, saying that talking about this periodic amnesia, where we get it, we lose it, we get it, we lose it over. And I just had to go back through and look at that history and write about it. And then you become discouraged and think, well, we're really going to get it this time. And Judith Herman was saying back in 1992 that an understanding and sort of taking on board the implications of trauma is only going to occur in a political context where people who are affected are empowered. And that's our kind of a hopeful message about the recovery movement or paradigm, is that it's a profoundly political movement, and hopefully that's what's going to hold awareness of trauma in the system this time, is the voices of people who are affected and their full partnership in the system.